For every dollar in healthcare, whether you're a fully insured client or a self-funded client, is approximately 80% claims. And again, like car insurance, house insurance, health insurance, it's all the same. If 80% of it's claims, then if you want to reduce your premium costs, you've got to reduce the cost of the claim. This is not rocket science, and yet no one talks about it except people that aren't the national carriers. If you're a national carrier, you don't want to talk about that. The more they talk about that, the more questions you start asking about why the premiums keep going up. A CFO's job is ultimately to control costs for their organization. And spreadsheeting and shifting carriers to control an insurance premium has nothing at all to do with controlling costs. Insurance premiums are driven by the cost of claims and the frequency of claims. And so it's simple math. Reduce the frequency, reduce the cost, reduce your insurance premium. That's where a CFO should be focused. And that's where he focuses on the rest of his business. He focuses on managing supply chains to control cost. That's all we're talking about in healthcare. Fully insured clients have little to no ability to control their costs. It's all premium costs, number one. And the only way to control a premium cost is, number one, to switch carriers, number two, to raise deductibles and co-insurance, but that's nothing more than cost shifting. That's all we're talking about. Self-insured clients have the ability to actually control the supply chain in healthcare. What does a knee surgery cost? What does this drug cost? What does this office visit cost? And if those costs are out of control, let's all talk about it. Let's figure out how to find cheaper doctors, better doctors. Let's figure out how to educate our people. The fact of the matter is, self-funded clients have their information, and information is power. With the information, you make better decisions. So one of the things that often goes overlooked in healthcare today is how you find a quality doctor. Every time I ask someone how they would find a knee surgeon or an open heart surgeon, the answer is inevitably, I talk to my friends, I go where my doctor says, or I go online and look at the results for that hospital. One of them is just marketing. That's a hospital telling you they're great at something. That's just marketing, okay? One of them is your doctor sending you there, but your doctor's owned by a hospital system. His contract says he has to keep you in the hospital system. He's not going to send you to the Cleveland Clinic. He's going to send you up the street to the local hospital because that's where he gets paid to send you. And then asking your friends, that doesn't help anyone. So what WellNet's been able to do is create a program where members call in, they speak with a registered nurse, and we've done all the research on the back end with our partners. We have physician profiles on over 815,000 physicians that enable us to talk to our members about cost, quality, malpractice, lawsuits, readmissions, complication rates, all these different things, so that the end user is ultimately feeling better about the care they're consuming. They're getting higher quality care because there's nothing random about it anymore. We're doing the due diligence up front, and we're finding fairly priced providers, which is a win-win-win. Yes, there's a growing sentiment that employers should absolutely be viewing their health care plan as a business unit. Many employers have put their hands up and said, there's nothing I can do to control anything. A claim is a claim is a claim. If I move to this carrier or that carrier, it's all the same. But if you view it differently through a different lens and start to control the independent unit costs that go into healthcare, that's where you start to control your health plan, improve quality, lower cost. The right kind of prospect for WellNet and the right kind of prospect for you, if you're looking to do things in the way of the future, is someone that wants more information, someone that's willing to go against the status quo, someone that's willing to change the way they think. Real healthcare reform already happened. You just got to change the focus on your lens, and then it all becomes crystal clear. Your insurance premiums are based on cost of claims, frequency of claims. And your insurance carrier can only add a 15 or 20% margin on top of that. That's how they make money. That's known as the medical loss ratio. What WellNet does is we help clients identify cost and quality in advance of care. We talk about the things that your insurance carrier is not talking about. We help you lower the 80% of your costs that are claims. And that means that we can't charge you as much for insurance. It's obvious. But because most of the insurance carriers are publicly traded companies, they don't want to have that conversation. They need the premium to keep going up. As your partner, we need the premium to keep going down.